everybody. Thank you for joining us this Wednesday morning. A lot of people will be gearing up for the international school holidays next week. So am I. So I thought that, we'll have this talk to refresh everyone on their first aid knowledge. Now, this morning, we're joined by Dr. Shivani from International Medical Clinic. Not only is she my beautiful neighbor, she's also the head of the department at IMC Children's Clinic and board certified pediatrician from the US. Meeting someone. During her time in the US, she has practiced in hospitals in New York and in New Jersey at the trauma centers there. So it's very exciting to have you this morning, Dr. Shivani. Can you tell us a little bit about yourself before we start your slide?
Okay, all righty. Hello, everybody. Good morning. Happy Wednesday morning. I am Shivani. I have been working in the US for 15, 20 years. Before, like 5 years ago, we moved to Singapore. I was the trailing spouse for my husband. We came here. My whole life I have worked in trauma centers and New York, New Jersey, in one of the tougher neighborhoods where, of course, the kind of trauma that you see in US, as we all know, is different from what we see here. So when Susan reached out, like, oh, should we do something about the first aid? We're like, yeah, good, great. That is very, I think, interesting. And sometimes we all kind of, as we gather on our trips, as we are here, a few things which we can do, ranging from simple things to bigger things. Hopefully nobody has to use those things. I thought, okay, we'll talk about that. So yeah, I'm happy that I'm here to talk about and little things about first aid and how to be a little better prepared. Okay, so we will begin. All right, so when we talk about first aids, I mean, what do we mean by first aids? Basically, I say first aid is just the first thing that you do, basically some sort of a medical technique that you do in an emergency situation. That emergency situation can be simple emergency situation to a bigger emergency situation, but knowing and providing those simple things or techniques can prevent first from that emergency situation from getting worsened. Okay, basically, so you're preventing any further injury, you're trying to recover, trying to promote the recovery, and in the end trying to preserve life, right? So I say few tips that I always say how to do this technical. Okay, so I say now summer is here. We're all getting on travel plans, or even if we are not there. I want to tell you a little bit things about some traveling tips before you go away, some first aid kit and essential that you should have. We'll talk about some common pediatric emergencies and situations in which you can do something to help. And I'll very briefly in the end touch about what are some CPR basics when the children are concerned. Okay, so now I'm sure we've made our travel plans. I always say whenever we are traveling to Europe, okay, to South America, anywhere, we want to make sure, are we up to date with our vaccinations? Are our children up to date with the vaccinations? Because we live in Singapore. Singapore is a very safe country, but very different country, unique sets of concerns here. So as every country has different sets of issues, different sets of requirements also, that we want to make sure we are up to date. Like if you're traveling to Brazil, South America, you need to make sure that you have certain vaccines like yellow fever, otherwise you won't be able to come back to Singapore. There will be quarantine involved. So always before travel plans, especially when the children are concerned, and we have so many vaccinations for children, it's a good idea to always make sure that we are up to date with vaccinations and what are the travel vaccination requirement for that country. Like Singapore is rabies free, right? We don't give rabies vaccinations to even puppies here. And the rabies vaccinations for adults, like pre-exposure, are not really routinely given. But if you're traveling and you're going to camp somewhere where you may be exposed to bats, raccoons, dogs, cats, all of those, monkeys, they all can be rabid. So it's a good idea to consider that. So vaccination always. And if you come to our clinic or to go to any doctor regarding travel planning, they will advise you accordingly. So it's always that tip that to keep in mind, to have that vaccination checked out and see. Now, I always also say, regarding when we travel somewhere else, especially with children, right? We are going for a week, 10 days. We're going to be in an unknown country. Some places, even we don't even speak the language, right? But we're there. So it's a good idea to have a hold of what are the local emergency numbers, right? What is the phone number that you're going to call? In Singapore, it's 995. In the US, it's 911. In Europe, it's 112. So if you have an idea of what number to call for the place you're going, that can also be a little helpful. God forbid if you ever land up in an emergency, just to have that handy, and we're not figuring out how to do that. So that's something to think about. And of course, we travel. There can be, God forbid, if there's an emergency situation, there can be expenses involved. So it's always a good idea to have travel insurance. In European countries, some of them, they won't even let you travel if you don't have that travel insurance with you. So always good to check with your provider to kind of, before we, start our journey, and an amazing trip, God forbid, should not turn into something else. Okay. So I say always have a little, especially when we're traveling with younger children, I always like to have my first aid kit, okay? Like essential things that pack in a kit. We don't know what is going to come handy, right? With small children, we definitely want to keep fever medication, okay? Commonest things, okay? Next slide, I'll tell you a little, just go over what are the exact doses, because sometimes when we're in a different country, we want to make sure that we carry fever medications. We also want to carry some nausea, vomiting medications. We don't know. We're traveling to Vietnam. We're traveling anywhere in Southeast Asia. We always say, Bali, this can happen, but it can happen in any country. We want to have prepared for having some nausea medication, some electrolyte solutions to kind of help. There's also some diarrhea medications that can be had once in a while needed. Just be prepared for that. If your child has some sort of allergy, so definitely we have to carry some antihistamines. These are all besides the prescription medications that your child already had. Definitely we want to carry the prescription medications, right? EpiPen, if there is allergy, all right? If there's definitely, we don't want to forget that. Asthma, right? We want to make sure that we have enough supply before we travel. So that definitely goes in our first aid kit, okay? Now, equipment-wise, of course, we definitely want to have a thermometer. You don't know how much handy a tweezer can come at times to pick out the foreign body, to pick out something that is there. Tweezer is a good idea. I always say some sort of a dressing, okay, like a gauze pad, okay, some tape, some Band-Aids, okay, all of those. Good idea to have a rollerblade, gauze dressing, some wipes to wipe it down. Although, of course, if there's any injury, you will wash it down, you will apply the dressing, but have that dressing and an antibiotic ointment, okay? These kind of make our very basic kit for you to keep, especially when children fall, cuts, all those things can happen. And if you have all that handy, that can be, it causes less stress. I remember mine are teenagers now, but when they were still, they needed, but they were younger. It's always good to have that handy. And my husband would just be impressed, but I don't know why, but that is another story. But yeah, so always good to have that kit with you to kind of, know when you will need it. Just simple medications. So two common medications for fever, paracetamol and ibuprofen. Just a rule to remember, paracetamol is 15 milligram per kilogram per dose. In children, it is dose-wise. But then you have to remember, if they're reaching adults' weight, like some teenagers, right? They're 40 kgs, they're adult weight. So then it becomes an adult dose. It's never per kg for a adult weight. So just that keep in mind. When they're younger than 5 years, I say younger than 7, 8 years of age, mostly it's 15 milligram per kg per dose. Paracetamol is given every 4 to 6 hours. And then there's that. I normally reserve it for lower grade fevers. When I say lower grade, it can range from 38 to 39. Helpful to give paracetamol, can bring the fever down. This you can even sometimes in the middle of the night, the child wakes up, you can give it to them. While ibuprofen, we don't recommend it giving on an empty stomach or the child hasn't eaten because it may cause some gastritis. But that is good in a way that it is given every 6 to 8 hours. So you don't have to give it as often. And the dose for that is 10 milligram per kilogram per dose, mindful of the weight of the child. If it's an adult weight, we don't do milligram per kilogram. We just do adult dose. Okay. All right. So just a reminder for all of us to have that. Now, the next thing I want to, this is a busy slide in which I will talk about, there are a few things that it's a nightmare, every parent's nightmare, and I think every doctor's nightmare to have those things happen to our children. And as careful and as prepared or careful we are, but accidents do happen. So some common things of what we can do, how we can be helpful in that situation. So we'll talk about a few of those conditions. First one is choking. All right, we're out in a restaurant, we're sitting down, and our child just starts coughing suddenly, right? And for an adult, I'll tell you how to do it for an older child, and we'll just go through a younger one first, right? This is our 7-month-old baby. He started baby-led feeding. We have a piece of broccoli that we are trying to chew on it, and suddenly you think that he's trying to cough. So the first thing that we always do when the baby is that small, we say less than a year old, we turn the baby face down, okay, on our forearm, okay, and in a way that the baby's head is lower than the baby's chest, because we're trying the gravity also to kind of that food particle to come out, okay? We place our heel on the back, alrighty, in between the baby's shoulder blades. We try to back slap them, okay? Hopefully nobody needs to do this ever, but I'm just saying that is the thing, to have that presence of mind. If you think that the baby is choking on food, you just roll the baby over, put the head a little bit down, then the rest of his body, and then pat like 5 times on the back. Okay, do the slap, turn around, check if the baby has spit it out. If has not, then again, we do that. Okay, we can even put a pat on the front a little bit, then turn back again, and then do the back. Okay. And if you still feel the baby, while obviously, I mean, we are in this digital world now, when this is happening, somebody is already probably on the phone calling for help. Okay. So in the back days when we were not as digitally connected, we used to say, do this first, then call for help. But now I'm like, no, do that simultaneously. Call for help while you are trying to attempt this. So that is one way. Hopefully, a lot of times this baby will dislodge that whatever is choking and will be able, I mean, this all going to be okay. We still want to be evaluated, but I would say that is something to do. The other thing, if it's an older baby or if it's an older adult also, I think, done maybe this, we don't call it Heimlich procedure anymore. We call it abdominal thrust. But anyways, what we do in that procedure, let's say we're outside, husband, adult, a teenage child is choking on the food. We can't obviously roll them on the back. So we stand behind the patient, right? We stand behind the patient. We wrap our arms around the waist, okay? We ask them to bend a little bit forward, okay? We make a fist with our one hand, okay? And then we put our another. So basically you're going to put your fist and on top of your hand just above the belly button. And then you try to push that, okay? You're going to push it, like maybe you can do it 4 or 5 times. And that sometimes they're leaning forward, you're pushing that, and that can sometimes help you dislodge. Again, you're doing this, somebody is already calling for help. Okay. All right. But of course, I mean, God forbid, I hope it's happening in the middle. It's with just one person. Then you do this and you do it at least 5 times. Okay. And if still nothing, then of course, if that you're the only person there, then you call for help. But that attempting that can correct it and all will be resolved with no problems. It may sound like, oh my God, how to do it, but it's actually if you ever practice doing it, it is doable, and then it's very gratifying also for everybody in the end. So that is something to do if at all we encounter any choking. Now, another nightmare, okay? We all go away. Of course, we live in Singapore. Our kids are in the water and water safety as much as we have being careful, but, we always say extra, extra, extra careful. There has to be fencing, there has to be the pools. We have to really watch them like a hawk. It does not matter if they know swimming or don't know swimming. I tell my parents and my patients all the time, does not matter if they know how to swim. You still, of course, if they're champion swimmers, they're there, but we never know. I would like somebody to be there, not necessarily to save them, but we always like to be there to kind of see how to help them, in what way, what needs to be done. So drowning is another nightmare, that it is very hard to do anything at that time, because everybody is, of course, it's natural to have that panic happening, how to help and what to do. But we have to, try ourselves and see simple things that if we can do anything at that point, and that can save definitely life, right? So always, we are by the water, if we are alone, depends on the situation of what is the scenario. We always say you cannot put yourself in danger when you're trying to rescue. God forbid, we are at the beach, okay? We are in the ocean. And if this is happening, you have to call for help and then try to go, because we don't drown with the drowning, as harsh as it may sound. And if your child is, God forbid, in that situation, of course you will want to run, and of course you will want to do everything you can, and you should, I think, but always keep as a backup some awareness of what is happening, okay, and how much you are putting yourself into the danger situation, whether we will be able to do what needs to be done at that time, okay? So we say somehow arrange for help, and then try, the first thing that you do is try to remove the victim from the water. We try to remove the victim. We try to see a response and see, we call it a primary survey, okay? So we say, check for any danger, check for a response from the person, okay? And then once we've taken the child out, or them out, because if it's an older a teenager, it is sometimes very hard to take the child out also, especially if they have immersed and if they have swallowed the water. So I would say, take the child out quickly, let's look for a response. And the first thing that you do is they open the airway, okay? We open the airway by just pulling the chin like that, so that the airway is open. And then we check for the breathing. Of course, the chest rise can be looked at and see if they're breathing, but also putting the hand definitely near the nose we can understand. And try to see if they are not breathing, not responding, then you have to, of course, start the CPR, okay? We will touch base, we'll come to the end about that CPR and how to do that, and how we can, simple ways, while somebody is calling for help, how can we do that? But those are the simple things, that you take them out, you put them on the back, and then you try to open the airway by just lifting the chin up to just see if that can help, and they'll start breathing or not. Sometimes, and if you notice that they're breathing, then we turn them back, okay, and then we lay them in a recovery position, which also I will tell you, so that they can expel whatever water they have inhaled. The next thing that I wanted to touch base on is burns, right? It could be sunburn, okay, or it could be any thermal burn, okay, that we are there, somewhere the child is exposed, okay, to a burn thing. We always say, stop what you're doing, remove definitely from the heat source. This can be, God forbid, a building on fire, anything. First thing we do is we take off all the clothing, whatever they have, okay, and then we place whatever the burn is under water, okay, underwater. We never ice it. We never ice a burn. Always run water, okay? And water also, regular temperature water. It doesn't have to be cold water. We want to run regular temperature water. And it also helps with easing the pain. And of course, it helps to cool it off. And then after we've run the water for 10-15 minutes, we cover it, okay? We cover it with the loose, non-sticky dressing. We don't put any grease, we don't put any products, because we want to breathe it out. And then see, depending on how much the burn is and where the burn is. If it's involving the vital organs, meaning if it's involving the face, the genitalia, then we definitely have to quickly go to the hospital. If it's a smaller burns can be also partial, superficial thickness, deep burns. But I think it's always good. Some burns may need antibiotics, some burns may not need antibiotics. So all those can be decided when you go to the doctor, but some certain burns involving the vital organs regarding the eyes, regarding near the face, the genitalia, they all need to be evaluated by the doctor quickly. Some little misconceptions that I wanted to point out is we never oil, we never put creams, we don't put toothpicks, we do not pop the blisters, okay, and never use ice over it, okay. We always run water, we bandage it loosely, and we take some pain medication, and we take the kid to the doctor to be evaluated to see if anything else needs to be done. Now, another thing that, with the fever, sometimes what comes is convulsions, okay? Or if we are that unlucky in a different, in an unknown new country, our child has a seizure for the first time. Seizure is just, tonic-clonic convulsion. The body is shaking. Sometimes you can have seizures because of fever. Also, a lot of children can have it, and especially some have a history, then the parents are kind of better prepared and know how to manage it. But for those, we have to be aggressive with treating the fever so that the seizures don't happen. But if at all, have you noticed any convulsions, shaking of the tongue? So first and foremost, I always say, stay with the patient. Do not leave the patient. Somebody else can call for help. Somebody else can arrange anything else needs to be there. And you start timing the seizures, because the time of the seizure is also important. That patient is starting to have a seizure, have an idea of, okay, this is the time. We roll the patient to the side so that the aspiration doesn't happen and so that the airways open, okay? Definitely move them away from any harmful objects, that if they're seizing, they can bang their head. If there's sharp things, we move them away. Do not try to stop the seizures. It will not stop. You can just hold the hands. You can give them a recovery positions, okay? Please don't put anything in their mouths, nothing that we try to, sometimes if you see in some, ER videos that are like, okay, people are trying to put this in the mouth. Don't put anything, just put them in through the side, put their right hand over there, over their cheek, and then around the body, and then just put them to the side, and then wait for the seizure, God forbid, to stop. If the seizure you think is prolonged, lasting more than 5 minutes, we have to. By the time, hopefully, we'll already have called help, and the help probably is on the way. But if it's more than 5 minutes, we have to be urgent. Then it becomes status epilepticus that definitely needs medication for you to stop the seizures. Now, if ever you think that because of the seizures, it's normal for them to be unconscious that time. If they're generalized seizures or febrile seizures, that their eyes will roll up, they will be sleepy, and they will start snoring that they're no tomorrow. But you make sure that they're breathing. We just keep an eye on that. And if the person will be postictal, meaning they will be sleepy after that, and they may not return to normal, depending on the age of the child and what scenario are you in and how the child looks. Of course, definitely we go for evaluation emergently, or we can wait for their things to settle down if they're breathing okay, and we can then take them to the doctor for the evaluation. That is that side. So now I know I have talked about this recovery position a lot of times. So another thing that can happen a lot of times is, now these simple things, but then you may find your child to just, they're especially common in teenagers, they will be standing up, and then for long periods of time, it's hot outside, they may just decide to faint. Or God forbid, there's an injury, their fall, and they may faint. So if you come across an unconscious child, okay, and if they're still breathing, so you notice if the child is on the ground and if you are there, you run for help, you notice, you put your hand in front of the nose and see if they're breathing. And if their chest rise, you see a little bit that they're breathing, you put them in the recovery position and then wait, call for help and see how they can. But the recovery position is the best position for them to maintain their airways, because we don't know what is the cause of the fainting, so if it's not a neck injury that we are worried about, we roll them. And put them in the recovery position, meaning you put your hand to one side of the cheek, and then the second photo you will see, you pull the knee to the other side, you put the knee there, and then in the third photo you will see that you put the the patient's or the hand under the face, and then you put the knee to the ground so that they are maintained in that position while you get ready to call for help, okay? We always talk about, okay, if the patient is breathing and you're not sure what's going on, put them in the recovery position. That goes for children, adults, everybody, okay? And let's say if you have a baby, so how do we do it on a baby? Baby's not gonna stay like that. They may not put the hand there. So then in the babies, you hold them in your arms and we try to do the same way. You put them in your arms, head lower than its stomach to keep the airway clear, use the back of your hand under their nose, and then that way you can feel their breath also, and then you call for the emergency services. Alternatively, you can put a blanket under them and then put them in recovery position. All those positions are great, especially if their febrile seizure has happened, if there's a seizure episode, we want to put them in recovery position and then wait for the ambulance to arrive, okay? So that any aspiration, they're not going to aspirate, everything is going to be nice and clear, okay? And everything can be come out. Now, minor injuries, right? Kids fall, okay? There's a bruise here, there's broken, if until unless there's a fall, and if they notice that there's no, God forbid, obvious deformity that you notice, okay, some simple things can be managed right there, okay? So if you notice an obvious deformity, let's say, for example, of the forehand, I always say, please do not try to fix it, okay? But let's not try to fix it, okay? If it's deformed, we put them in a little sling to make it the most comfortable position, okay? We're not going to maneuver it. We're not going to do anything. Of course, the child is in pain and child is screaming, okay? We call for help, okay? But if we have anything, that's when the gauze in your kit or something can be. If it's an arm, you can put them in close to the chest, and you can even, if you can't figure it out, just wrap it around the body, okay? So that they place in one position. If it's the leg, okay, whatever things that are available, we can just wrap a bandage around it, okay? Alrighty. And then unless that is when it's an obvious deformity. If there's nothing, and if the kids are able to bear weight, we follow our RICE principles, meaning the rest, we have to give the rest to the injured area. We put ice over it. We can put a little bit bandage over it. And at night time, we keep them on an elevation to help the swelling go down. Another simple thing quickly, I think I'll go through is a nosebleed, okay? Nosebleed happens. I'm sure we all know how to fix it. You just pinch the nose. But I always say when they're children or adults, okay, we never pinch them and we lean them back. We always lean them forward, and then we keep on pinching the nose, because we don't want them to aspirate it, because then they'll have to swallow it. And children, they become really uncomfortable. They're already scared that their nose is bleeding and somebody's holding them. They're crying. And then if we pull them back, so make it a point so that they can lean forward, okay? So that they don't have to now do this added task of swallowing this, and blood tastes disgusting in the mouth, okay? So if that happening, they're even crying. So it's a whole thing. They are stressed, parents are stressed, everybody's stressed. So I say, to help with that, just lean forward so that they don't have to swallow it, and keep on pinching it for 10 minutes. And hopefully if this stops, okay, if it still persists, then it's time to go to the emergency. Now, I think we all know dog, cat bites, rat bites. I mean, lately I saw in my clinic a rat bit him. The child's the finger was totally taken off, and I thought Singapore had small, tiny rats, but I guess the rat was feisty and bit the whole thing off. I thought in New York subway, I'm used to seeing big rats that are there that I feel like they can chew off. But this one took a big pulp of the finger off. So anyways, God forbid, I hope it doesn't happen to anybody, but if it does, let's put the wound under water. Okay, we put it under water. First, if it's bleeding like there's no tomorrow, if we put pressure on it, we take a gauze piece, we put pressure on it, okay? We try to squeeze it so that the bleeding is somehow stopped. And then we irrigate it really, really, really well, okay? We irrigate it really well, depending on how the bite is. We have to, of course, we put a little bit antibiotic ointment. This is all first aid, right? And we wrap it up. And then we focus on, okay, which is the one? Dog, bat, a dog, cat, rat who is biting, what is happening. We need to go see a doctor regarding rabies, what needs to be done. Okay, but this is just a simple, just washing really well. Sometimes I even say with soap and water is also okay. To just, we want to wash everything. Washing is the first thing. If we do, half of the whatever the virus, if at all there is rabies, will be washed away. Okay, so that's just to do that. Now, another thing, I mean, not as much here, but I think we've had it in the States, in Indonesia, everywhere, tick bites, okay? We have ticks. We see, I have removed so many ticks, and they're like, oh, now the tick bite, the tick is there, how to remove it? And then the instinct always is to just, whatever comes out, we just take it out. But we say, no, we want the whole tick to be out, okay? So always we say, that's when the tweezer comes in handy. So we always say, take the tweezer out. We have to grab the tick close to its head so that the full tick comes out, and no pushing, pulling. We have to just gently, we have to take it off, because the longer the tick stays on your body, the more chances of all the, tick bites, all those diseases being transmitted. So we want to take it off, and the more blood it sucks. So we want to take it off as quickly as possible. And then after that, we just very rigorously wash the area. Yep. Living in Singapore, right? We all are out. It's too hot right now. Like, I think it's too hot everywhere. Everybody is going to Europe right now. I was talking to a patient 2 days ago, and it's 95 degrees in Rome already. And I'm like, oh my God, it is hot. It is hot. There are 100-degree temperatures everywhere, and we are out and about. If we are going to go visit, we have to see places. So yes, with small children, it's even more, we have to be careful regarding these symptoms. Okay, of course, heat exhaustion can present in many ways. In Singapore, I really commonly see spasms, right? They have spasms in their cough area, spasms in the body. They all have that spasms because sometimes we forget to drink water, a lot of it, okay? Little children especially. So I think having that, spasms are okay, but we have to just be mindful of heat exhaustion and then heat stroke. Heat exhaustion, we say we face it if we're out and about a lot. So just be mindful of, we've nausea, headaches, fatigue, tired, annoyed, sweating a lot, okay? Little bit raised body temperature. Definitely, please stay in the air conditioning. Please lay down in the shade, drink lots of water. The thing that we have to really, really be mindful of is the heat stroke. Sometimes because the heat exhaustion, the next stage is the heat stroke. To prevent heat stroke, we have to keep on drinking lots and lots of water all through the time, electrolytes, Gatorade, ginger ale, whatever we want to drink. So heat stroke is something, it's an emergency, real emergency. The temperature rises up to 40 degrees. Okay, we become disoriented, we are dizzy. That needs to be going to the hospital, because we really, what do? We take all the clothes off, okay, alrighty. We can help, okay, to not ice, but we say just the same way as we do it for when the fever, sometimes we have to do sponges to take the fever down. In this case also, we do that, okay, all right, so that we don't end up in that situation of disorientation, and then we have to do, God forbid, convulsions, and hopefully not coma. Some last slide on, I wanted to talk about a little bit about, we have lots of creepy crawlies all over here in Singapore, okay, spiders, God forbid, snakes. Okay, so I say few things to keep in mind, okay? So pressure immobile, wasps, okay, bee stings, all of those, we do a few things differently for different things. There's jellyfish here that stings, so how do we approach? There cannot be one approach for everything. Every individual bite or a sting needs a different approach. But broadly, I want to tell you that, God forbid, if there's a snake bite, right? First of all, we don't know. Most of the snakes are not poisonous. And there is no treatment until you go to the emergency. The only treatment is the venom, okay? That's the anti-venom that we need. That is the treatment. But until that happens, what do? We don't do sucking and spitting and sucking. That is never, never, never done. What we do is we can bandage it, okay? We don't even do the tourniquet anymore, okay? Tourniquet is never done. The sucking is never done. We just wrap it, okay? And we can put cold compress it so that in the hope that whatever venom is there is not spreading to other places. That's what we're trying to prevent. Until we reach the hospital where the antivenom is given, we are trying to decrease the spread. Basically, as we talked about first aid, decrease the injury from happening, right? So we're gonna, the two options, right? If you are having a cold compress, just put ice over it. Nothing you can figure it out, just put ice over it. And that works for bee stings, wasps, sometimes the ants, okay? Scorpions, even snake, but put ice over it. If we don't have that, put a tourniquet around, not a tourniquet, put a pressure bandage around it, okay? Now, when it's jellyfish, okay, when it's the sting of the other, in Australia, I think there are lots and lots of different types of fishes that can sting you. Hot water, okay, not hot like boiling water, but just lukewarm water. You soak your feet in that water. There are certain instances when we say pouring the vinegar, okay, especially if it's a jellyfish or there are some other types of fish, sometimes vinegar, basically alkaline. But I know there's one patient long time ago asked me, can you pee on it? And is the urine is also okay? I mean, I guess if you don't have anything, that's okay, because urine can be alkaline, but we don't, of course, don't recommend that. So vinegar and hot water will be my recommendations to be doing for that time. Now, last slide, okay? Last slide, I just want to check base of how to do the CPR, okay? I mean, of course, none of us are trained, of course, besides the doctors, nobody else, no parents are trained in performing a CPR. And I hope that never, as a mom, and it is the nightmare to perform CPR on your own child. I cannot even imagine that anybody can do that properly. So, but I always say some things, if at all, God forbid, we are ever in that worst case scenario, always good to know a few things to what to do, okay? We always make sure, of course, surroundings, we make sure that whatever we are doing, we move the patient to a safer area, if it's possible to move the patient, okay? Now, next, we have to make sure that there is space for air, okay? Airway, ABCs, we just do simple ABCs. Every year for our training purposes, things keep on changing, but I say airway, just see. If you can't do anything, just tilt the head back using one hand and then tilt the chin. Basically, you just move this and then you move this. Never do this here because we don't know if it's going to block the airway. We just tilt the head, okay, by this and then open the chin. That is all you do to open the airway, okay? And then you see, you try to get a response. If the patient is not responding and if the patient has check for breathing. If there is no breathing, then you shout for help, get everybody arranged, people have to call up, and then you have to check. So we say airway comes first. You have opened up the airway a little bit. You try to get a response, no response. Then you check the breathing. And if you notice there is no breathing, okay, you call for help that there is no breathing. And then you see, you look, do the survey, see if they're bleeding from anywhere quickly. Do you want to help with the bleeding? You have to, somebody else can put the pressure, and then you start the compressions, okay? The chest compressions, knowing is how to do those right. I don't think that requires a proper training for us to be doing that. But let's say in a layman, we're in the middle of nowhere and it's just the two of you. Until you call for help, I would say call for help first, and then we start the chest compressions. The chest compressions, the first we give 2 rescue breaths to the patient, and then we start the compressions. On the small children, we actually have to give 5 rescue breaths, and then we start the compressions. The compressions, the way to do it, of course, it has to be demonstrated. It's very hard for me to online on Zoom teach you how to do the compressions. And I don't think that can be learned this way, but I would say safely that, if it's a small newborn that you have, you take your 2 fingers, okay, you put them on the lower end of their sternum, like the mid bone. And if you can't figure out anything and you're in that desperate situation, that is where the pressure that you apply hopefully should make it 1/3 of the chest goes down, okay? I know it is very hard for me to make you understand and for you to learn it, but that is if nothing you can do, that is the one thing you can do. And for older kids, you put your one hand and you put your other hand and you take it to the lower side of the sternum bone, and then you start pushing on it, okay? Alrighty. How much to push has to be learned, okay? But again, as I say, if we are in that desperate situation, we will take anything that works by the time the help arrives. Okay, so hopefully nobody ever needs to be in that situation, hopefully never is in that situation that we need to do all those things, but that is the way to kind of do it. But first check, we have to go in order, check for any dangers and around it, see if the airway, because it's clear, we check if they're breathing. If they're not breathing, we try to give them mouth to mouth, okay, 2 times or 5 times, and we see if they're breathing again in that time. If they're not, then we start the compressions. Okay, and that is it. And I will take questions if there are any. I know a lot of information I gave.
Yes, well, I have a few questions. If you stop sharing, then we can see you in full view.
Okay, I will stop that. Is it good now?
Yes, perfect,
Okay.
perfect.
All right, okay.
So there's a few questions here. So, you know, when you were talking about like check for breathing and check for circulation, how do you actually check for breathing? Do you put your ears by the
So there are
nose?
a few ways,
Or...
a few ways today. The best way and the most absolute way is take your hand, put it closer to the nose, okay? While you're doing that, you keep on looking at the chest movement, if that is happening or not, okay? Alrighty. Some people even say that but you know, who's gonna look for that, right? If you're wearing glasses, you put the glasses on top here. And if it miss, okay, then you can see that they are breathing, okay? But that is the thing. I know when we're in panic, it is very hard to understand that, but those are the 2 ways. You will see a chest rise when they're breathing, okay, or the belly rise, okay, anything, and then you will do. But I say, you know, if anybody is doing that, they're in the panic mode, right? Okay, as much as we say do not panic, but everybody panics, okay? So then doing the both things at the simultaneously will give you an idea of that. I remember when we were training very early on in med school, we would like sometimes breathing, not breathing. It's very hard to understand that. So of course, with no training, it is hard to understand. But I say that's why I do 2 things simultaneously together to kind of understand.
Right. And for circulation, do you check here like what they do at Grey's Anatomy? You know, like in the movies?
I know. So for that, I would never say do the carotid pulse, because that is harder that's what when professionals check it in that way. But I say you can try to listen for the heartbeat, okay, if that is happening, or you can do it if you want to. We can check here. Normally, we have to check it there. I say if you're in the field and if you're unsure that whether this is happening, whether there's a pulse here, whether there's a pulse here, okay, I would say do more rather than less. Okay, if we're in that desperate situation, of course. And if you start compression, if the child is normally breathing, they will be telling you like, oh, and or be responding to you in other ways where you will know. Okay, breathing is more important to assess that if they're, because that's when you will begin everything. Circulation, even if the child is fine, the heart is pumping okay, and if you do chest compression, it's okay. It's okay.
Yeah.
In 1 or 2, you will know, you know, but I will say oxygen, especially in the cases of, let's say, drowning. Okay. In drowning, because the lungs are totally immersed and drowning, the death happens because oxygen is not there. So it's very important for airway to be open and for them to give us those breaths rather than chest compression. So yes, even if you do chest compressions and if we are not sure, that's okay. But I think breathing comes first. So first we establish that.
Okay. And speaking of breathing, when you were talking about like opening up the airway, you were saying just opening the mouth. Do you lift the neck up?
Yes. So if you're not worried about a neck injury, right? God forbid there's no trauma, there's no fall, then you can maneuver the neck in the sense that then we call it head tilt and jaw lift. So we tilt the head like that and we open it. So basically we're opening it up, right? And
right.
This is the way to do it when there's no head injury involved, okay? And if no spine injury when we are worried about. When we're worried about the spine, we don't want to move too much, right? Okay, but again, breathing takes precedence over the spine injury, always, okay? If we're not sure what we're doing, and if you think that the patient is not breathing, then yes, we don't want to do, that's okay if you do this and if you do this, okay? Alrighty? Because I know nobody is going to do this, and at that point to assess whether there's a neck injury or not, we don't know, because if the God forbid, let's example of drowning. If they went down in the pool, whether they hit the neck, hit the head, what happened, we don't know. It's very hard to assess. Of course, you're taking them out and you have maneuvered them that much that their neck moved and everything. So it's okay to do that. But otherwise, yes, if they're not drowning, if the not drowning is not the situation, we definitely say move it and then do so opening up the mouth is so that the tongue doesn't fall back, and then there is space, anatomical space for them to breathe.
Okay. And just going back to like the first aid kit box. So I take a lot of people walking, and I've decided to take like this giant box a first aid kit, and I bought that at the pharmacy. So that's okay to have at home, right? Or is there sort of like a mini kit that, do you need a kit in your car? Yes.
You need a kit in your car. You need a kit in a bag when you're traveling with children or adults, right? But see, definitely if you're prescribed medications, you should carry that all the time, like Ventolin, right? Kids with asthma or allergies, EpiPen has to be in the bag. So even if people are going with you on a walk, they have to have that on them all the time. Obviously, you can't have it for everybody, right? But it's a good idea for them to have it and for them to know, because sometimes the bee sting happens there. If they're really allergic, then we need an EpiPen. By the time the ambulance comes, we need an EpiPen. So I think if they're prescription medications, definitely, but obviously we can't be prepared for every scenario that we have, but it's a good idea. Yes, so those travel kits are good. We just make sure that they have antihistamine in them. Okay, they have bug spray. All those things, of course, definitely depend on where we are going. But yes, those kits are good.
Yeah, no. So I take people to like MacRitchie, and like once you're in the middle of MacRitchie, there's nowhere else to go. You can't really exit. So you kind of have to help them and then try to, well, I guess carry them if they're not injured, not crazy injured. If they're bitten by a monkey, God forbid, or a snake or a bug. So it's good to have. I've been walking around with a bigger backpack now because of my first aid kit, which is good.
Which is great. Yes. And MacRitchie, it's just one way, right? You just go and you have to finish the whole thing. Yeah.
Yeah, there's no exit. You can't call a grab or anything. So
Yeah.
Another question was mixing medication. So can you actually can you make a cocktail of like antihistamine and paracetamol? Can you all take that in one go?
So okay, so we don't advise them mixing outside in a cup. Of course, they go in the belly and they all mix, okay, and that's okay. But we don't advise them mixing outside and making a cocktail and drink it. We don't mix it. But yes, if let's say fever, like for simple ibuprofen and paracetamol, we say sometimes the fever is like 40, 41. I think the viruses these days are so dramatic that they're causing fevers up to 40.6. I mean, 40.6 is a very high fever, and God forbid if they have febrile convulsions. And paracetamol, you give it, it doesn't touch it, right? So yes, that I say one time you can give paracetamol, you gave it right now. And then in 10 minutes, 15 minutes later, if the fever is still not buzzing at all, then you can add on a Nurofen, okay, or ibuprofen, okay? Give it to them together within a span of, I would say, an hour, half an hour, 45 minutes, you can give it. But then, of course, paracetamol can only be given every 4 hours. Ibuprofen can only be given after 6 hours. So yeah, mixing in this way is okay, but not outside in a cup and drink it, no.
Oh, no. Yeah. What I meant was like mixing it, like, staggering them, but kind of
that
in
is
a
okay.
short period of time.
That is definitely okay, because we need it sometimes and it won't break the fever otherwise.
Okay. This question is just out of my curiosity. Like, because I've heard a lot of people like suffering from strokes these days. And what does stroke look like when it actually happens to a person?
Okay, so of course, in a children's perspective, I have seen 2 strokes in my career of 25 years, okay? But of course, I know of how the stroke looks like. Stroke is nothing. Stroke can range, it has a very wide range. It can range from a little bit weakness in the arm to a full-fledged paralysis of the body. Yeah, so it can range from all the ways. I would say if ever, first of all, if there's some kids with antithrombin 3, some deficiencies of certain proteins, and I had my 2 patients it's heartbreaking for 16 and 17, they had strokes, but that came on. But so commonly, the strokes will present as paralysis, right? As paralysis of the hand, of the feet, of the whole body. Sometimes the speech is slurred. That is very typical of stroke. But I've had paraplegia, even just the weakness, okay, of the arm can be a stroke. So if we are of that age, or even I say if no age, if they're concerned about weakness, that is an emergency and we need to treat it accordingly. The stroke really needs hospital, okay, really needs, because, we in the ERs, we used to have that 90-minute window where they, from the time the stroke is called, that they have to arrive and have to go for TPA or anything that needs to be done. Basically, the diagnosis of stroke has to be made and management begun within that 90 minutes, because that's the window. Otherwise, we lose a lot of things. So yeah, stroke the presentation can be very, very varied. Adults, it can be varied. So children, of course, I have sickle cell disease patients and they've had stroke. So there are certain conditions that we know kind of predisposed to stroke in children, but thankfully there are not that many, that they don't cause stroke as much in children. But yeah, in adults, it's a really different ball game and it can be very varied. So if in doubt, I would go to the hospital.
Yeah. And what about for someone who is having a heart attack? Does it look all the same too, or not?
So no, it's heart attacks. From what I know and what I know, they will, most of the time, heart attack is a very, I think we all use it in a term when it's something concerning with the heart. A lot of times they will feel like, they are having some chest pain, some difficulty breathing, right? They can't breathe. Or I've had some nausea, vomiting. But sometimes it is just the feeling of uneasiness. They just don't feel right, okay? They feel like something is off, okay? And if, let's say, God forbid, right now we see 20, 25-year-olds having a MI or angina. But I would say older times, if you're of the age, I don't know, I definitely am getting there. If you're of that age, definitely if there's a feeling of uneasiness, any of those, then it's a good idea to get it evaluated. So chest pain, shortness of breath, uneasy feeling, okay. Chest pain, shortness of breath is definitely a major thing, but just uneasy feeling, okay, not feeling right, requires or warrants an evaluation.
Right. And what about if you have high blood pressure and you've forgotten your medicine and you're feeling super ill? So what do you actually do to kind of, make yourself feel better or make that person feel better in the meantime before you actually get your medicine?
So I would say, sitting down in a calmer, environment, okay, laying down, trying to getting some rest, okay, until you can get your medication back. But if that feeling keeps on getting worse and worse, because we know high blood pressure predisposes to stroke, predisposes to everything. Yeah. So we give it a reasonable amount of time. What is that reasonable time? Of course, varies with the situation. But if we sit down and we just try to calm ourselves down, lay down, okay, drink a few sips of water. If that is all is helping you, then it's great until we get your medication and you can take it. Depends on what your doctor has prescribed it. Otherwise, if this feeling persists, then we go to the hospital.
Okay. Yeah, that's definitely an emergency,
Yes.
Okay. Another question. Any special instruction CPR for older adults or parents in their 80s, for older people? You might, maybe you can't put too much pressure, you might break a rib or something.
Yes, no? Definitely. See, I don't have personally much experience regarding the pediatric training with older, but yes, I would definitely assume so because, they're osteoporosed bones. We don't want to be. Sometimes, I would work in the ED, and of course, adult and peds would be similar, and trauma, everybody, we would see them. And I've had EMT, over enthusiastic EMTs performing 60 CPR on a 90-year-old lady. We have to be careful. Don't break the ribs and cause tension pneumothorax, more damage. Okay. So there are strict ways. That's why I say this is a skill that, God forbid, in dire circumstances only should be used by people who are not trained. Okay. And the same goes for children also, right? How much pressure to put? It's very hard to teach until you've had a formal training to do it. So I would not, but again, in dire circumstances, we do anything, right? We do anything to do that. So I would say yes, with caution in older people regarding that CPR or cardiac compressions that you have to do, okay? Very cautiously, because we don't want to cause more damage rather than helping. So in first aid or in our void, there's rule, try to do not to do too much if it's not needed also. But of course, I understand when we have nothing else to understand, nothing else to do and we're in those situations. Sometimes we have to do things, and but knowing the proper way to do it is also, So I would always say, if their children and if they're preemie babies who have preconditions, I say parents, we actually used to give CPR training to parents, okay, kids who had apnea. And I always say, if you have elderly that, some comorbidities in your older parents or grandparents or anybody, it's a good idea. There are some courses that you can do and can be certified in doing CPR. So at least you will feel a little bit better also performing, God forbid, if the need arises. So it's a good to equip yourself with those skill set. So in case of any need, you can do it better.
Yeah, definitely. Like, speaking of courses, I think I've, decided that when I come back from holidays, I'm going to arrange a CPR course or a first aid course, like physically for all expat living readers who are interested to come along, because I think it's quite important. And especially, if someone needs help, you really need to, and if there's no one there, you need to jump in and kind of be, involved. So, and not just, just stand there and stare, right?
Definitely. I mean, definitely. The worst nightmare is if it happens on the airplane. I mean, I'm sure everybody, all of us are explaining, oh, is there a doctor there? And then you're like, oh God, I hope there's no CPR I have to perform. That is the thing that we all as doctors talk about, like, because we're in the middle of the airplane, there's nothing to be done. And how long is the flight? It's a whole, that is my biggest, like, I hope there's nobody that I have to perform a CPR on a child. I'm like, simple things, asthma, all those, do it, but we just have to be one thing too. For everybody, I think it's a good idea to have that skill with you, especially if there's older or younger people involved in our lives.
Yeah, definitely. Another question. Can you take any home medication if you're suspecting of a stroke or a heart attack, like aspirin or something to thin the blood?
So your doctor must have prescribed it to you already beforehand, and only then you would take it. Okay. Alrighty. That's the only way I can think of. Like, I would not advise just managing it at that time when a patient is having a stroke, some next door or anybody saying, oh, this is my medication, you want to take it? So I would rather call the ambulance and be there to help. Yes, in heart attacks, in certain things, they're prescribed aspirins, okay, to help. Okay, sometimes nitrates are prescribed in certain parts of the world to help prevent that. Okay, so there are certain medications that are prescribed, but definitely it's a good idea if we have a certain history to have that chat with your doctor to keep some medications at home in case of, like we say, emergency medications. So yes, there are medications, but as a peds doctor, I am not the best person to say, but yes, there are medications, and please have a chat with the doctor to say, what is that medication to help you?
Yeah, because you can't just give any random one, right?
Yes.
Yeah. Okay, right. We are closing in to 11 o'clock. I don't have any more questions for you because I think your presentation was amazing. And I think you covered so much and so well. I'm going to remember to tell my mother not to use toothpaste for the burns, and not to use garlic for animal bites, because that's what she used to do when I was younger. I'd burn myself, cover myself in toothpaste. So that is not, it's a myth, is it?
It is a myth. So my mom, I mean, again, but who knows? I always say with that, right now, that is the science we have, that no, that is not recommended. Okay. But who knows? Like, I don't know, maybe 20 years from now, we will hear that, oh my God, what they used to do was the right thing. But who knows? But as of now, that is not recommended.
I know my mother is super convinced that if you get a animal bite, that you just have to rub garlic on it and everything will be fine. But she's Filipino, so she rubs everything on with Vicks, and she thinks that Vicks cures everything. Anyway.
Yeah. No, my mother also like that. She thinks that if you rub a key onto a bee sting, if you wet the key, metal key, that's a very Indian kind of remedy, and that fixes everything. But I guess, only science will tell us later on what those things are. Yeah.
Well, that's amazing. I, for one, am very happy that you live just beside me. So I always have someone. But for those who don't and who are not lucky enough to have a doctor in the building, please make sure that you have all the kits ready in case of any emergencies. And I hope for everybody who is traveling this summer, Have a great trip. And if something emergency comes along, now you know. This is a recorded session, so everyone will get the slides today. And I hope that has been helpful. And stay tuned after the summer so that we can organize the CPR course for everybody. I'm very interested in doing it. So thank you, Dr. Shivani, for joining us this morning.
Have an amazing summer, everybody. See you around.
Thank you so much, and have a great day.
You too.
Bye, everyone.
Bye. Bye.
Bye.